right? Cardiovascular disease, however, is not a natural part of aging either, but we oftentimes hear of other people or ourselves dealing with cardiovascular disease. And such is the case with a client of mine currently. And so I thought, well, how does cardiovascular disease impact falls? And if you take just a brief second to think about it, the inability for our heart or any type of obstruction of our heart or inability to pump blood at a natural pace is going to disrupt the amount of oxygenated blood to our muscles. Our muscles need oxygenated blood for contractions, right? To shorten and lengthen. We need blood in that area. In fact, when we start exercising, those muscles that are contracting, like when we're squatting, my legs are placing a purchase order, a demand on my heart for more oxygenated blood to my legs, right? There's a lot of chemistry going on down there as those muscles are contracting, lengthening, and shortening, and my heart has to keep up. And as I exercise, I start breathing a little bit heavier to get that oxygen in so my heart can get the blood to the lungs, and then the lungs back to the heart, and then back to the legs, right? My heart rate starts to increase. Well, cardiovascular disease can impact your ability to contract those muscles. Falls are a leading cause of injury in older Americans and carry the risk of permanent disability. This is what we know. This is why we're here. And high medical costs come with unintended falls as well as premature death. This is nothing new for us. For those with cardiovascular disease, the risk of falls is even higher. It's a lot higher. In fact, 60% at a moderate or high risk for falls are those with cardiovascular disease. 60% higher. Medications that you're taking for cardiovascular disease can also increase your risks. You'll have increased what they call frailty, right? It's just, you guys like frail. You guys know what that is. And then abnormal heart rhythms, low blood pressure, which is a big problem, especially we've got our postural hypertension, right? Postural hypertension is just when we stand and you ever feel a little lightheaded and have to sit back down for a second. Anytime you stand, your blood pressure drops. When you're in bed, you wake up in the middle of the night, you're headed to the restroom, to the bathroom. You stand, your blood pressure drops. This leads to a lot of falls for people going to the restroom at night. You know, what you want to do is you want to sit up in bed, count to 3, stand up with your legs touching the bed, count to 3, let your blood pressure regulate, and then continue on to handle your business, okay? The medications as far as cardiovascular disease is concerned that are associated with a higher risk of falling are going to be those medications if you have heart arrhythmia, if you're taking antidepressants, anti-anxiety medications. Coincidentally, I've had a personal experience with this, not me, but someone I love very much was dealing with some anxiety, and this was new to me. I don't really get nervous, I guess, the way some of these other folks do. I get nervous in other ways, but what I did was went and did some research and found that exercise was as powerful of an anti-anxiety medication as Zoloft. It's a fact. So if you know someone suffering from anxiety, exercise, and walking is considered exercise. All right, go for a nice relaxing walk. Diabetes medications, diuretics. High blood pressure medications like beta blockers, opioids, non-steroidal anti-inflammatory drugs, NSAIDs, things like Aleve or Advil. And then you have SSRIs or serotonin reuptake pills. Those are antidepressant pills, right? Serotonin is the feel-good hormone. And so when you eat carbohydrates, potatoes, cake, right? Their serotonin is released in the brain, and that's what's going to make you happy. Sometimes people have a hard time with the receptors in the brain capturing that serotonin. So what they do is they take serotonin reuptake, and it opens those receptors up so more serotonin can get into those receptors. So very good. All right, let's cruise here. Different types of cardiovascular conditions, right? You've got syncope, which is fainting, heart failure, arrhythmias. Guys, see if there's anything there. People with heart failure are 13% more likely to fall than those with other chronic diseases. That's pretty telling. And atrial fibrillation, right? AFib, that can definitely impact your ability to get oxygen to the body. And let me just check this last page, make sure I didn't have any notes here. Good. Cardiovascular disorders are recognized as risk factors for falls. The aim is, they did a study, and this study that I'm reading from, they reviewed 86 different studies, right? And the most consistent association with falls were observed with people with low blood pressure, right? Out of these 86 studies, the most consistent association with falls were observed with people with low blood pressure. Second was heart failure, and then cardiac arrhythmia. And then, and most of the time, guys, when we're dealing with strokes and things like that, you're dealing with arterial stiffness. And that can be an independent predictor for falls, right? So take away everything else. You see some hardening of the arteries, some plaque buildup, and that is an independent indicator for a fall risk, all right? So there's more there. I'll let you guys do the research. I've already...